Okay, so as always, I really thank everyone for being here. I really think it's a gift to do what I'm able to do, especially in its current form, and be able to provide this kind of education to my community. That's really who I'm most concerned about, being kind of family medicine doctor here. But obviously, this in the future as a video hopefully can help anyone who takes the time to listen to this. Again, kind of the other thing I'll say in opening is, again, I don't pretend to know everything about this topic. This is just what I know up until this point. I hope to discover much more about this. And if anyone has anything to contribute, obviously, that's why we do these meetings live in this forum. So that people can ask questions and contribute their own experiences, especially on this topic, which is a very personal topic, I think, and really involves a lot of, just your own personal experiences and narrative. And that topic obviously is mental health. You can see here on the screen a few things that I'm trying to get across to everybody, kind of just what is mental health, the importance, how do we then start to assess it, and what are some ways then obviously we can improve it, probably the most important thing that I'll try to go over today. Again, I think I've sort of said this in other ways, but this is, again, just meant for general information. I am a doctor. I'm maybe the doctor of some people in this room. However, this is not a appointment. This is no doctor-patient relationship or anything like that formed with anyone else who is listening to this video. I have no conflicts of interest for anyone that I mention in this video or any of these resources. They're just things that I personally find helpful, but I don't have any conflicts of interest in any way with any of the companies or any of the podcasts or anything else mentioned. Okay, so what is mental health? That's really where I'll start. So it's, I think, kind of a complicated topic, but I think having some sort of framework around what are the sorts of things we're looking for is important, so that then we can start to measure and improve those things. There's a saying, that which is measured gets managed. So in mental health, we try to give one of my objectives is try to give you some of those things. Defining self. So there are different models of what is self. Basically, we think of sort of the basic definitions of something like consciousness might be that we're kind of can experience or think about our own experiences from sort of outside our own body or outside of our own immediate emotions and reactions. There are all sorts of different concepts of self. There's a certain psychologist or psychiatrist, actually, Paul Conti, who has a really interesting model of self also, where you sort of have the unconscious mind, you have your defense mechanisms, you have your character structure, and then you have kind of that conscious mind. So I don't think I'm trying to prescribe a certain model of self to you here today. I'm just saying that if you've never thought about, who am I, what am I think that's a very basic human question that is worth pondering. I think that's one of my main messages. And we'll talk about, different things that can kind of model that framework and kind of be, unique to you and your culture and your family and where you come from. Again, my intention is not here to give a prescription so much as to give kind of frameworks for everyone to figure out their own path forward. But again, just having some sort of definition of what you think self is, what you think you are, asking those questions and pondering those questions, I think, is a big part of mental health. Having a sense of purpose kind of goes right along with that. I think that's a very human experience. We all tend to really have more kind of these other things if we have that sense of purpose and meaning. We'll see some definitions of kind of happiness that include this. Many different spiritual practices really kind of point to this as one of the, kind of essential parts of their practices. And so just having that sense of meaning, again, this doesn't mean it has to be any one thing. So questions that you could ask here is, why was I born? What is my life about? Is there something so important I might die for it? So these are some things that might get to what I'm talking about there. Other things that kind of might be in that mental health realm is, what is your mood? Obviously, that might be described by emotions, emotional words, happy, sad, and then we can get much more complicated from there. Language and mood is kind of an interesting um, connection there, and that's where I'll talk a little bit about just how culture and other things can play a role here. I think a sense of energy, people tend to think about energy sort of maybe as more of a physical trait, but I'm going to kind of argue that I think energy has a huge mental component, and I think a big part of energy is mental health too. We'll talk a lot about how physical health is tied into mental health as well. But again, I think that there's a part of energy, a significant part of energy, that's probably housed in this more psychological mental health realm. Contentment. So I think, a sense of contentment. So if we're talking about being mentally healthy, I think that having a sense of contentment is sort of what a lot of people might talk about as sort of a healthy mental outlook. Being able to regulate emotions, right? So not necessarily that we don't feel emotions. That's not mental health. We're supposed to maybe have a range of emotions. I think that's very human. And that's not what I think being mentally healthy is. I think it's more being able to regulate those emotions, being able to, what we'll talk about, kind of let that prefrontal cortex, maybe part of the brain, decide for you what to do, rather than letting those kind of limbic system, more basic emotions, maybe run your life. That might be kind of more of a scientific kind of view, and what neuroscience is kind of telling us about emotions and emotional regulation. So that's what I would say is a huge part of mental health, is, again, being able to recognize maybe those emotions too is the first part of that. And then being able to kind of decide what to do ultimately with those emotions. Another concept here is cognitive flexibility. What I kind of get at here is really just the ability to kind of take information from the external world, and then if there's sort of a belief that really maybe even firmly hold, that if all of the external evidence maybe tells you otherwise, that you're able to change that view. That might be sort of one example of cognitive flexibility. This is just, again, kind of being able to change thoughts, basically being able to change your own thought patterns, being able to decide maybe that certain patterns aren't serving you, and to then make a change here. I think that's again a huge part of being mentally healthy. And then I think, again, this is kind of almost a prerequisite. So I put that here, just physical health. Without physical health, I don't think you can really have the full amount of mental health that you could potentially have, let's say. That's not to say that, they're completely mutually or that, again, the people with poor physical health can still be quote unquote happy, I believe. But that's to say that, having good physical health can only help your mental health. So anyway, so that's the best way I can say that. I don't think I have to necessarily talk about this as much these days, which is really a great thing. But why care about mental health? I think over at least even early in my career, I feel like there's still been a stigma around talking about mental health. That for some reason it's not important. Somehow it's less important than other aspects of our health and body. And I just think that the data really points otherwise. And that's, as a kind of physician scientist, that would be the number one thing that I should really be looking for. And then on top of that, there's some obvious things that I'll point out, like if you're so miserable all the time and you're rich and physically healthy and all this, I mean, I just don't know, like, who would wish that life upon anyone, necessarily. So if that's really, so anyway, so statistically, as far as how this ties into other aspects of health, you get basically increased risk of almost every chronic health problem that you can think of when you look at the ties with poor mental health, whether that be kind of just basic, mental health diagnoses like anxiety or depression, all the way up through things like post-traumatic stress disorder, bipolar, schizophrenia, diagnoses like this. Even just the diagnosis of depression is what I'm saying here increases cardiovascular disease. In some studies, up to fourfold from the general population, even after, let's say, a heart attack or stroke. If you are to either have depression or develop depression, the amount of kind of risk that you have complications or that you die early, prematurely after that is so much higher with or associated. And again, we don't have causation in this data, but those associations are very, very strong. And it kind of makes sense intuitively if you think about it. Metabolic disease. So, again, with depression, with even childhood trauma. So there's these studies that were done on children with these things called ACEs, adverse childhood events, that showed associations with, and there was, I think, 9 different things that they could test positive for. If they tested, answered yes on 3 to 4 of them, the increase in almost every, so obesity, addiction, diabetes, hypertension, all sorts of things really went up with those adverse childhood events, which were things like a parent went to jail, a parent hit them so hard they left a mark, a parent had a problem with drug or alcohol, some things that, unfortunately are pretty common in our society, and many of us have grown up with. So, self-harm. So mental health is potentially a deadly, disease as well. So a lot of people might not necessarily think of it that way. Yes, it does increase all these other diseases, but obviously suicide means you killed yourself. So that is obviously a deadly disease. And obviously that is actually becoming more and more of a problem in our society as time has gone on. And we can talk about some of the reasons that might be. Decreased productivity. Again, this is just in your own life. This is not about, towards your employer or anything like that. I'm not talking about in your career necessarily, though that's also true. But, this is just in all aspects of your life, what you could, sort of produce and make out of the world around you. Maybe the happiness and joy you could bring others, just all sorts of different aspects of kind of productivity. Here I'm really not just talking about financial, just again, what you can kind of make out of your life, I think can definitely be taken away if you don't have good mental health. Here, increased risk of addictions. And this is both with substances and processes. Again, addiction is not always with the substance, but can be with food, with, gambling, with, even sex or pornography, things of that nature. So there are lots of different processes that people get addicted to and have, different problems in their life as a result. And often that's kind of a, outlet for some sort of deeper mental health issue that they're struggling with and maybe haven't found a healthier outlet for. I'm a big believer that addiction is much more associated or has to do a lot more with maybe other mental health issues than maybe just using a substance or having gone. Do you again, like, why can some people go to a casino once and never go back, or not go for 5 years? Other people go and become totally addicted to something like a slot machine. Again, there's something going on there deeper than I think that just that, oh, this is a bad thing. This all casinos are bad now, or whatever with even substances, right? I would say the same sort of thing there too. So unlocking full health. I mean, again, this is just this is a huge part of everyone's health. I think a huge part of that health pie, if not close to 50%, maybe more. But and if you don't have that, there's sometimes an attitude that something traumatic has happened to you, something bad's happened to you. Well, that was a long time ago. I don't think about it. I suppress it, and kind of put it somewhere else, and but have never necessarily found some way to kind of be at peace with that. Then I just really strongly believe that you could find a way to be so much healthier if we do look at those things and find a way to do that. There's no right answer here of how to do that. I'll kind of jump forward to just the how, and that becomes very personal, very difficult, and one of the most maybe difficult tasks, for just in the human experience maybe. But and I certainly don't have, any real definitive answers there, but I just know that it's something worth our energy. So what are just some different types of influences on mental health, just to kind of get an idea of like what are the different spheres we can all look at and think about, and maybe what are, again, some of the influences. So I think it's important to acknowledge that at least I believe that humans are really kind of a spiritual creature in some ways, and that's sort of tied into our brain and biology. We tend to ask, all I'm talking about here is sort of asking the questions of, why are we here? What is the, kind of universe about? Some of these kind of questions of, just looking at the world that's larger than us and understanding that we're kind of a small part of that. I think that's what I mean here. Again, yes, of course, this can involve more, let's say, religious views. And again, I'm not here to endorse or to not endorse any specific views there. And I think this is just a personal journey, and that what I'm trying to say here is acknowledging that we're spiritual beings is an important part of mental health and the human experience. Psychological, this is again just like emotions, right? So feeling emotions, understanding the way that that past traumas cause these certain types of rewiring of the brain, and makes you think in certain ways, and maybe makes you it's just human biology to be that way. It's not about being weak or less than or something like that. Just understanding that it's like our brains are sort of built in a certain way, evolutionarily, I believe. So, and that really is around, and we'll talk a little bit about that kind of as we get into what emotions are, what happiness might be. So cultural and societal, here, just again, acknowledging that we all are kind of human beings that are supposed to kind of grow up in a tribe, and, who we grow up around and that support structure around us is extremely influential and important. And that is really tied to our biology. And so acknowledging culture is not a bad thing. And, being proud or being, expressive with your culture is not necessarily a bad thing. I think, when I get to kind of cognitive flexibility, I think what I'm talking about maybe in this aspect is also accepting other people's cultures, and that there can be another tribe, and that, that can actually make life more beautiful, and can even make your culture even more important, anyway, that's kind of my view, just that acknowledging this and accepting kind of others is, a path to mental health, and really can help us increase awe, for example, which is one of the things I talk about as, one of the ways to really increase mental health. Family of origin, again, just here acknowledging. So some of us have healthier ones, and some of us might have less healthy ones, and just acknowledging that that's an influence and probably will drive certain behaviors in you, and that's something, I think a big part of mental health is not necessarily always totally being able to change some features of who you are, but maybe accepting some features of who you are and sort of accommodating your life for that. So this may be kind of in that category as well of, you have to kind of accept your family for what they are, and that you're a part of that too. And again, whether you're kind of taking the good, leaving the bad, and however much of each there is, that's obviously a very personal experience. Physical health, I kind of mentioned this again, just, again, what you eat creates dopamine. How much you move and how much skeletal muscle you have is so influential on just so many different hormones in your body and the regulation of just your, blood sugar. If you have insulin resistance, so many different ways that physical health can influence mental health and the ultimate kind of efficiency and operation of your brain. Let's just say on a very biologic level. If we're talking about mental health, obviously the brain is heavily involved there. All of our thoughts and feelings, everything is generated in brain structures. And so again, ultimately, this is a little bit about brain health. And if we're talking about brain health, you have to talk about physical health because those things are so tied together. And so again, that's where physical health certainly plays a big role here. Chronic diseases, again, I'm not here to say if you have a chronic disease, you can't have mental health. I'm just saying, treating those chronic diseases in a way that really, is effective and that you prioritize in your life, I think can only really boost your mental health and maybe a huge barrier, let's say for many, to having better mental health. So that's really what I'm getting at here. And then again, I mentioned those past traumas, just kind of highlighting how important that is and how influential that can be in many of our lives, unfortunately. Okay, so what are, again, some things that are really needed here on the, for kind of optimal mental health? I think I've kind of hit on a few on these already. So nutrition, here we're just talking about, again, balanced nutrition. I'll get into, certainly kind of some specifics of what that looks like when I get into the improvements section. These are just kind of things to think about, the pillars, I think, of mental health. Movement. So these are things I think that people just don't always include in mental health. Movement. So again, all forms of movement, this meaning just like walking. This is also all the way up to exercise. But all forms of movement really do, the brain is really built for movement, and a big part of, mental health is helping your body or your brain be healthy. And that's where movement's certainly important. Sleep, again, huge part of mental health and brain health. Prioritizing sleep, 7 to 9 hours for most people. Social connection. So again, we are kind of these, Homo sapien that has evolved in this kind of tribal culture of connection and needing other human beings in certain ways. Just some examples, a human baby is born and, they can't walk, they can barely feed themselves, they can barely do anything for, almost several years, like basically up to at least a year or two. Before a year they're walking, and then finally, it takes a long time, whereas this, it's like the other day at the hospital, they're like, oh, a deer was born, and then they just kind of stumbled around and started walking and chasing after their mother, right? So, and they just watched that happen out the window of the hospital. So a little bit different experience for some other mammals. And humans really do take a lot of that social nurturing really as a kind of requisite of our, just ability to even be here on Earth. So again, social connection is kind of tied into what and who we all are. So just finding that balance for yourself there. Sun, again, we are on a rock hurling around this star, and we have to kind of accept that, that kind of periodic sunlight and darkness is something that we are really attuned to, and that our bodies have all sorts of sensors for, and that so many processes of our body, hormones, vitamin D, just all sorts of different things that people know about, melatonin, but so many other things, even testosterone and estrogen are influenced by sunlight on the skin, and in the eyes, so many different things that happen with setting circadian rhythm and how important. And there's huge associations with sort of, let's say, poor mental health kind of diagnoses and outcomes, and sort of day-night dysregulation. So there seems to be these big associations there. And again, is that causative? We don't know that, but there are studies that really show those big associations. Self-inquiry, again, I've sort of talked about this, just what am I Who am I? What are the kinds of tendencies I have? I think thinking about this is really important for all of us to, really have then increase mental health. And then again, this is kind of goes back to that, purpose and meaning, intention, goal setting. These are things that are important part of, I think, the human experience, and really help drive us and help, really boost mental health in a lot of different ways. Yeah.
I think something to also identify is with things like this and mental health in general, the things that you can control versus the things that might be out of your control. So when you think about family of origin or past traumas, you probably didn't have an influence. Like we didn't get to pick our family, we didn't get to pick our experiences. But a lot of these things and moving forward, we do have control of how much we prioritize sleep. Do we get outside? What do we put in our bodies? Who do we surround ourselves with? I just think that's an important element too.
Absolutely.
Control. What can we not?
Yeah.
And the discernment to know which is which.
Right.
And yeah.
Right.
And I guess that was kind of that's great. That's kind of the unspoken thing I've said here, is that like all of these things are in our control. Right. So, right. So these are the kind of things that we can control. So that in the previous slide are some things that we can't necessarily control. Right. So that's a good distinction of what I was trying to get across here. So the science of happiness. So this is just an interesting body of work. People, I don't know that I personally even realized that there was some stuff like this out there. So if other people are aware, then great, but maybe hopefully this, for folks that aren't aware, some of what I'm talking about, or a lot of what I'm talking about here, is taken from Arthur Brooks' work, who's a kind of happiness researcher, really good credentials as a book with Oprah, works at Harvard, anyway. So he definitely is kind of one of the experts, I feel, in this field. So I'm going to kind of go over some of his concepts here of the science of happiness. And so he kind of talks about, a different kind of a way to think about happiness. So one of the fundamental things is that, he sort of says happiness is not a feeling. Feelings are evidence of happiness, right? So if we kind of are always, he says, and then the analogy kind of uses, at least in the Peter Attia's podcast, is, that if then you would say, is the smell of Thanksgiving dinner the same as Thanksgiving dinner? No, not necessarily, right? So that's kind of analogy he's using for feelings. Happiness is not a feeling. And so he says, what is Thanksgiving dinner? Well, it's, fats, protein, carbohydrates, right? So then he uses this kind of macronutrient model. And so anyway, so then he says the three macronutrients of happiness are enjoyment, which he kind of talks about as distinctly different than pleasure, right? So pleasure would be sort of that short-term, again, maybe things like sex or sugary food or gambling or, other things like these kind of highly pleasurable things. These are more, let's say, basic, emotion would be something like pleasure. A lot of the things he's talking about as the macronutrients of happiness are sort of more what he calls these metacognitive, emotions of enjoyment, which he would call, again, joyful memories with people, right? So enjoyment meaning, okay, not necessarily. So he uses some examples like, but Budweiser doesn't show people like a guy sitting alone drinking, 13 Budweisers, right? He shows them opening a Budweiser with the whole family, everybody's laughing and smiling, right? And you're sort of happy with people, right? And that's what sort of he kind of is saying, pleasure versus enjoyment. Okay, so this is the kind of concept here he's talking about. Satisfaction, again, this is the sense of accomplishment after a hard task. This is probably the most fleeting one, he says. The other way that he talks about satisfaction is kind of taking your haves divided by your wants. And he says, the way to solve this equation is not necessarily to have more, but to actually want less, right? To decrease that denominator, right? And that's one of the biggest ways to maybe increase your satisfaction. Right. But again, just that sense of accomplishment after a hard task. This can be, a physical task. This can be a cognitive task. You can see some kind of evolutionary reasons that this might be important, that, if you're kind of very hungry, searching in the wild, find kind of a big, whatever, game or, berries or whatever it is, a big thing of honey, you want to sort of feel very motivated and satisfied and sort of, you want that to relay positive emotions to the creature in order them to really move forward with that behavior more. So that's where he says it sort of comes from. Meaning, which is defined as coherence, which kind of means that, things happen for a reason, that things, that sort of, I guess kind of almost like determinism too, that, things are kind of connected, interconnected and happen for a reason. Purpose, that, we have some sort of role to play in all of that, basically, whatever that may be. Again, that could be as simple as, raising your children, being there for your partner, I don't know, being a good gardener, just whatever you feel like that is for you, right? But and then other ways that people will talk a little bit about purpose. Paul Conti, one of the psychiatrists that also has some frameworks for this, talks a little bit about something called a generative drive, which I think is kind of an interesting concept. So this is kind of opposed to, let's say, the aggression drive, and the pleasure drives that a lot of people talk about in psychology. So he sort of is adding this generative drive, which basically he's saying that humans have a desire to sort of generate or change some, kind of have an influence on their environment. And I think that's a really nice way to kind of think about it. I think we do have this sort of drive to, just affect certain things, whether that be very, very small circles, or whether that might be, some of us have the, circles to affect sometimes the whole world. But again, whatever little influence you have, right, I think there's a desire to sort of try to use that in some way. And I think exploring that and understanding that that is one of our drives, shaping our purpose around something like that, I think is a way that we can also think about this. And then just significance, and kind of insignificance here too, right? Just both here, that we do matter, that we do have an influence, but again, that maybe that's not so huge that we have to always be focusing on ourselves, right? I think what insignificance allows us to do is not that your experience is not important. It's just that, you can kind of chill out and step back and say, look, there's 8 billion other experiences out there. There's a kind of this concept of shared human experience, which I get at later too, right? That you're probably not the only one experiencing something like this. You're a big, you're part of something so much bigger, right? And if we can just step back and focus on that, it helps us not sort of, maybe sort of be totally consumed with that, the Buddhist suffering kind of model of, life is suffering, the suffering. So you just kind of find a way out of that by focusing a little bit more on that insignificance. But again, not to minimize anyone's significance there either. So
Significance with perspective.
yes, yeah, sure. So just another kind of interesting thing, kind of fundamentals here. So thinking about that, neuroscience is kind of pointing to these as our 6 basic limbic emotions, right? So thinking about this, and I'll explain here in contrast to kind of metacognition, which is in that prefrontal cortex. So the limbic system kind of is that amygdala and these kind of what we call our more midbrain or deeper brain structures that people kind of associate with earlier evolutionary brain structures that are kind of less mature and less complex and maybe quote unquote less human, right? We have this big, huge prefrontal cortex. That's really what is so unique about the human brain and probably gives us this unique experience that we have in consciousness. So Again, what are those basic emotions? We have basically 4 negative and 2 positive here. So the negative, you can see sadness, anger, fear, disgust. So again, these are the kind of like basic childhood, reptilian, early, evolutionary feelings that are negative. And then we have sort of joy and interest, right, as kind of those 2 positive emotions. And then all of our kind of more complex emotions are really built up from this. And I think one of the models of the science of happiness here, right, is what are emotions? Emotions are these, signals. These are information, right? So the whole body is taking in all kinds of signals from its external environment. It's sort of translating through these brain structures, just maybe firing these certain types of emotions. And then what we see is, right, then prefrontal cortex can kind of digest all of this and then decide sort of what to sort of ultimately do or sort of feel ultimately too with that. If we have someone who is, again, kind of quote unquote mentally healthy, right? This is sort of maybe a neurobiological definition of that kind of emotional regulation. That's what we see. But what we've seen in folks with depression and anxiety and some of these other mental health conditions is that actually limbic system takes over and sort of shuts down prefrontal cortex and doesn't even allow that brain structure to kind of access the right sort of, even neurobiology to then feed back and say, well, no, this is not a situation in which I should be angry or fearful or feel disgust or whatever, or even let's say feel, excessive joy or excessive interest, right? So this might be more of that, let's say, OCD, where you're just, interest has gone haywire to where you're now obsessive about something, right? Or kind of maybe a manic state where joy has gone sort of overboard, right? And we're constantly sort of seeking that next high. So again, all of these things can be in sort of a pathologic way to, really harm the person or being. And again, I think health is really allowing, so what's becoming more evident in the science is that what this looks like from a kind of brain biology perspective, neuroscience perspective is like I said, allowing the front brain, the big brain. Do you guys kind of know what prefrontal cortex is? So the big front beefy part of the brain, whereas these structures are literally kind of near the brain stem, kind of more in the middle of the brain. So anyway, so that's kind of the anatomy there too. So I just think it's nice to sort of match our experience to this, right? Because I just think it's a really interesting body of work, and it really seems to align a lot with things that we experience. It really seems to really make a lot of sense to me, at least. So then there's this concept of metacognition, which is what I'm trying to get at as sort of that, healthy. We can allow that kind of big prefrontal cortex, quote, human part of our brain to actually decide, right, what to do with this information, right, that this limbic system has now relayed to that, right? We have to remember that emotions are really information that's trying to be relayed. So like some basic things would be like let's say disgust. Disgust evolutionarily is supposed to sort of alert you to something life-threatening. So if we're out in the wild and we eat a very bitter plant or something that's very, again, tastes extremely bad, a lot of times that's poisonous to human beings. And so, it makes sense to kind of have this trigger of disgust to sort of say like, oh, I'm not gonna, or let's say really rancid water. If we didn't have kind of this reflex to know that, these things are bad for us, something that's extremely moldy, right, then kind of, again, that wouldn't be necessarily good for our survival. So this is kind of the theories around why emotions are evolved in such a way, right? So again, fear is supposed to indicate that your life is in danger in some way, right? So these have these, kind of, let's say, evolutionary advantages, right? And then in our current world, we sometimes just don't have those exact situations, right? So then the brain will sort of say, like, oh, you're a different whatever than me. And then the limbic system fires disgust, right? And sometimes now this is where maybe a more complex kind of, emotion that comes from that is something like, fear and disgust. Then you start to go to hate, right? Oh, whatever, again, you name it, political view, religious view, nutrition view, view on whatever, how you feel about Western medicine, so whatever it may be, right? We sometimes, again, that limbic system's firing these sorts of things. If we don't sort of digest that in our prefrontal cortex, sometimes in the right way, then we end up in these places that, again, this is just the biology of maybe what's going on. So moving those things, not allowing that immediate reaction to kind of dictate the ultimate kind of outcome of those feelings, I think is sort of a model, and sort of what the science of happiness is showing is really effective. So again, quote, moving those emotions to the prefrontal cortex, again, deciding how to react to those emotions. This is kind of like what I sort of think of, or a lot of people will describe as mindfulness in action, right? So like something happens, I get to observe these sort of limbic emotions. This, again, ideal situation, right? Get to sort of observe, this happened. I'm very angry now. And but I'm not going to necessarily hit this person or yell or scream or whatever, and react. I can sort of observe that anger and then maybe move that into prefrontal cortex, find some way to sort of, again, maybe take a pause, count to 30 is what the evidence is actually showing. So, not necessarily 10. Okay, so again, literally counting to 30, right? So a serious pause, right? To put in this space so that, that part of the lower brain fires. You need about 30 seconds of that pause so that then prefrontal cortex can come back online, right? And say, no, 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 I'm actually going to get to decide what we do with this emotion.
That seems like OCD.
Yeah. Well,
I'm just,
yeah. Or you could yell and scream and, make a scene. So that would be probably the better option. So, so journaling. So here, a lot of people talk about sort of maybe like a gratitude journal. But one of the things that Arthur Brooks actually talks about is journaling about really like negative things. Okay. And putting those things down and then leaving 2 lines, and then actually returning to that at 30 days and 6 months and seeing, so using your negative experiences to actually sort of learn from those experiences. So that would be kind of one way to use journaling to actually be kind of a self-teaching tool rather than just sort of writing down things or always writing down things you're grateful for, which sure, like, having more gratitude, I think, is an important thing too. But this is kind of again, sort of using that tool to be a little bit more about self-improvement. And then a reverse bucket list is kind of another concept of Arthur Brooks, which is basically like a bucket list is things you want. So a reverse bucket list, you write down things you want, and then you cross them out, like as in you're going to let go of them. You don't want them anymore. You're going to try to want them less. This is kind of just a exercise of actually putting down the things you want and then watching yourself cross those things out as you didn't get them, and sort of as an act of letting go. So again, this is kind of an increasing satisfaction sort of, task that really allows then. So then if you cross it out, right, and then sort of the idea would be that the prefrontal cortex, if you really still, that's something you really want for yourself, then prefrontal cortex, when you crossed it out, it's taking it out of that limbic want and it's putting it into that prefrontal cortex want. So it's not that you can't still want that. It just allows you to let go a little bit of it and maybe see how much you really want that. I think is ultimately the exercise. So.
But when my question, I guess, is, you can't be happy all the time. But when we notice that we're angry or we're frustrated with something, if we push it away or push it back, can it sit there and then come back at a later time and present itself? I mean, again, it's good. I'm a gratitude person, don't get me wrong. But sometimes, things are not fun. Some experience you have with another person or even yourself. And I wonder about dismissing it, I guess, maybe.
Well, yeah. So I think if I've relayed that you should dismiss your emotions, then I definitely would hope that I can take that back. That's not at all what I'm necessarily saying. I think, again, I'm saying, what do we do with those unpleasant emotions, right? I think if you can kind of, and there's no real answer. I mean, I think personally what I would say is that you just kind of have to accept sometimes your situation, right? You sort of ride that wave of emotions. You're allowed to feel that. You deserve to feel that way, I guess, is what I would say. Sometimes it's like people are going through some really hard and unfortunate, uncontrollable things sometimes, right? And again, that's why I say happiness is not a feeling, right? It's not about feeling happy all the time. That's really not what we're getting at here, right? And that's why I'm saying the definitions of mental health didn't necessarily include happiness. I'm talking a little bit about the science of happiness, and that, again, happiness is not a feeling so much as it's composed of the abundance and balance of those three macronutrients, right? Of enjoyment, satisfaction, and meaning, right? And the more that you can build those things in your life, despite maybe these other negative experiences and negative emotions, right? That is kind of the, at least what a lot of the science of feeling, then content, having delight and peace in your life, right? Those are the kind of things that we say are happiness, right? These are the things that get you there, right? As far as that quote macronutrients, right? Does that make sense? Does that help at all? Or okay.
I think the acceptance is a place to, and to me, acceptance doesn't mean, okay, now you can still continue to walk on it.
No.
But it's an acceptance of the situation and then figuring out what you're going to do.
Right. Or that I'm saying, especially of like the negative emotions, right? That you're allowed to feel negative emotions, right? I think that's sort of a myth that, no one should ever feel negative emotions. That's BS.
Mm-hmm.
Life's really hard. Bad stuff happens. Like, you should be able to cry and feel negative emotions, and, but then getting stuck there and perseverating there, right? Then you start to maybe get in your own way. Perhaps at some point there's got to be maybe some boundary or ability to transition out of that. I think would be one of the pillars of being mentally healthy, and that's what I'm kind of getting at as this cognitive flexibility and emotional regulation. These concepts, right? That's that in practice, basically. Yeah.
So the macronutrients are sort of mental nutrients, I guess.
Yes. I mean, I think that's, great way to think of it, right? So again, okay, so these negative things are happening, or I'm in a hard situation. What are the things that I do have control over that can maybe increase, these three macronutrients in my life, right? And then just the understanding of what these emotions kind of are, right? I think that's the cool thing sometimes about being human. If you sort of understand, okay, let me go back. So, when you understand these six kind of limbic emotions, and then you can kind of look at them and say, like, well, what is this fear really about, right? What do I have control? You can put it, again, that's kind of this concept of metacognition, right? So rather than just feel the feeling, feel fear, understand that you're feeling fear, right? That's number one. So good. Like, yes, this is a bad situation. You feel anger, fear, right? That's signaling to you that whatever is happening is a terrible situation for you to be in, and that maybe you need to make a boundary, right? Or get yourself out of this situation. Or maybe you're just underslept and you know, somebody, you know, it was the third person that said something to you the wrong way, and, you know, but it has nothing to do with anything, and that's why you're feeling, you know, just, but acknowledging that feeling, and, you know, that you're feeling anger, right? And then sort of then saying, okay, how is this anger serving my being, right? I think is sort of what I'm getting at. It's not, I'm not saying don't get angry or don't feel angry, you know, but then saying kind of then making the switch of this anger is information for me to then pay attention to, and then get to quote decide what to, you know, ultimately do with that. Perhaps it's justified, um, you know.
And I
So
think that's where that pause comes in, the 30-second, 10 to 30 seconds. It's taking that pause and you can evaluate.
right,
You can think a lot of thoughts in 30 seconds
right,
and hopefully come up with a good next step.
right.
And I think like you talk about the journal or whatever, but it's, oh, I'm angry, and then just pushing it down. It's more,
No,
oh, acknowledging,
right,
acknowledging it. I don't know quite what to do with it, or this or that. It just pause, sitting with it, and either coming back to it later or the second pause.
And I mean, look, like, I'm not here to say I can maybe do this very often even. I'm just saying this is what the science of this is showing is effective. And I think, again, the times, at least I'll speak personally at this point, I mean, the times that I have been able to maybe, you know, especially in very high emotional states, been able to maybe use a pause or something like that. It certainly has made a big difference in my experience. So, I mean, that's what I could say, at least personally. Yeah, I haven't necessarily used all the tools I talk about here, but again, I think there are different ways to kind of get across these same sorts of ideas, certainly. But again, I think just highlighting this kind of, it's helped me a lot, at least, to think about it in this way, and maybe sort of how is it that we're gaining control. I think understanding that like we do have that capacity, that is our brain has that ability. You know, at least, again, a mostly healthy brain does have this ability, right? So then trying to tap into that and train ourselves to that, right, is part of mental health. The same way you train your physical body, you know, you don't go and whatever deadlift 400 pounds the first time you've ever deadlift or whatever, right? I mean, it's just, you're going to probably break your back or something, but you know, so it's, you have to train. Again, you have to work up to certain things and train and go through some unsuccessful times probably too. So I think acknowledging that's important, that yeah, of course we can't necessarily be perfect there.
And that it is a practice.
Absolutely. And a process, right? Evolving process at all times.
Doing it, you
Yeah.
get a little better. Eventually, maybe you don't get into those situations because you've seen it coming way ahead of time.
Sure.
Fixed it.
Absolutely. Yep. So anyway, we'll just talk a little bit about assessment. I mean, here again, just having some sort of framework. Hopefully I've given everybody some frameworks here to assess their mental health, or things to think about as sort of ways to assess their mental health. But, you know, the quote medical assessment is sort of defined, you know, in basically a manual called the DSM-5. TR is kind of the most up-to-date one. And again, this basically specifies the, you know, diagnosis codes in medicine for different mental health conditions, whether that be sort of substance use, whether that be, you know, bipolar, schizophrenia, depression, anxiety, you know, all the different things that we sort of can quote diagnose as a, you know, medical code essentially is defined in this, which is, you know, again, kind of a huge meeting of essentially, you know, psychiatrists and mental health experts who get together and sort of revise these things. So that's where that comes from. And again, that's kind of that medical psychiatric side of assessment. This is something that, again, a trained professional should really be doing for you. You know, again, you can certainly have suspicions, and, you know, again, you certainly don't need require a diagnosis to improve or to, you know, have mental health problems or either direction, right? I'm just sort of defining that this is the medical kind of definitions, basically. Other ways to just assess your mental health that you can do on your own are things like emotional check-ins, right? Just naming your emotions, understanding those 6 fundamental limbic emotions, finding kind of more complex names, or maybe some of our more, quote, metacognitive emotions. Again, love, compassion, elation, jealousy, envy. Some of these things are sort of more complex kind of emotions. Being able to, name some of those things both in the positive and negative directions. There's these cool things called like emotion wheels that you can kind of look up. That will show like kind of more basic emotions and then sort of the more complex emotions that sort of spring out from those. Yes.
Oh, yeah.
Yeah.
Brene Brown has a book called Anatomy of the Heart.
Sure.
That sort of describes a lot of those to develop that sort of language you're talking
Exactly.
about.
Yeah. So just finding again, perhaps more nuanced language, right, to describe the way we feel, even just to ourselves. But then oftentimes this is important in relationships, especially in that communication to the people around us and our loved ones. So again, just checking in with yourself, finding that language, finding kind of tapping into, what is that really kind of question, and exploring that, which again, sometimes is sort of sitting in some negative emotions, right? And so this is sometimes unpleasant. And again, to kind of reiterate that being happy is not necessarily always feeling happy and be a pleasant, process. So understanding drives, right? So I kind of alluded to this too, just understanding that we have these certain drives, right? We have a natural fear of death. We have, a natural desire to want to do pleasurable things. We have maybe this generative drive, this drive to really generate something in our world around us. Right. And I think understanding where you are in each of those and how much of each of those you might sort of have within you. Right. And then sometimes you can't always really change some of that. Right. Some of that I think is, what we see, like, let's say in the emotional component, is that basically there's kind of 4 quadrants, right? Everybody falls into 25% of the population is going to fall into either kind of high or low positive emotion, high or low negative emotions, right? So the 6 limbic emotions I was talking about, right? So then you can do these surveys and sort of see where you fall in the population, right? So you're either kind of high, low, high, low kind of stuff. And it's mad scientist, judge, poet, and cheerleader are the 4 categories that Arthur Brooks describes. So anyway, so these are kind of like, the point there is that some of that, like, you're not necessarily going to change, right? That's just the way you experience these emotions, right? Do you experience really high negative emotions all the time, but also really high positive emotions? That's sort of that mad scientist category, right? Then, okay, just accept that and just know you have to kind of build your life around that. This is the way you are, right? And so that's kind of, again, the model of mental health, and kind of the importance of emotional check-ins there. So therapy, counseling, this can be very highlighting in this process, right? So you can kind of think about, what I just said, you could do through, self-reflection, meditation, other different things like that. But sometimes it helps to have that third party, have someone else to bounce this off of, have someone that has a lot of experience and, just other tools and other little things that can point out to you or whatever, right? This can be a really fruitful relationship for some people to have that other person, whether that be, again, kind of a trained professional or someone maybe in a, more spiritual practice. This can also be, kind of a guru or expert or something like that, and of that manner, so it doesn't always have to be that traditional kind of psychotherapist kind of person. Mindfulness, I just alluded to, again, that meditation, being aware of your own things, just reflecting on that. Again, a lot of data to reflect that meditation techniques really quiet certain brain structures that are responsible for some of that rumination and driving these certain, kind of again, it allows prefrontal cortex to really have more control over that limbic system, is a lot of what the science of meditation is essentially showing, that it's kind of a workout, right, for that attention and focus, right, and salience, right. What is it that we give our mental energy to? What is it that we're sort of shining a light on with our consciousness and then mental energy? The concept of sort of salience, right, and sort of a one tool, it seems, to increase the ability for us to choose that, right, would be something like meditation, and many of the things we're talking about here. So that's kind of, again, sort of what's happening neurobiologically is what the science is showing us. Life's narrative and story, just again, acknowledging that this is this is a huge influence on a lot of the kind of who you are part, right? And maybe what, those drives come from, and what the, level of kind of reactivity and this, and, what your triggers are. So much of, unlocking your own mental health has to be sort of understanding your own life narrative and story, and sort of accepting, right, that the good and the bad both have a big influence on you, and we just have to find a way to, kind of deal with both sometimes. Biomarkers. So these are, again, just some things that, are becoming into, really more regular practice, and we're discovering a little bit more about things like HRV, heart rate variability, which is basically the beat to beat variability. So your heart doesn't necessarily beat like a clock, necessarily every second on the second. Let's say if your heart regularly is on average going 60 beats a minute, it might be just off the second mark by kind of milliseconds in either direction. And that variability can be measured by certain algorithms. It's been shown to sort of be tied to kind of a level of internal stress and vagus nerve activation, and can, again, be kind of maybe also a marker of psychological stress. We think could certainly be showing up as, say, decreased heart rate variability from baseline. There are certain labs that can at least certainly tell you the lack of, let's say, chronic disease or other physical issues, especially, right? There certainly aren't labs that tell you, yes, you're, 100% depressed. But, there are labs that tell you, like, hey, you might have inflammatory bowel disease, which is why you sort of feel like crap all the time. Or just whatever, other things of that nature. Anyway, so labs here really are more maybe around the assessment of physical disease, chronic inflammation, that hormonal systems are in balance, that you have sort of the prerequisites to have that optimal mental health, and brain health ultimately too. And then sleep trackers, if you have a problem with sleep, again, I mentioned that that's a big part of mental health. So certainly different ways to do that. Whether there's all sorts of devices, rings, there's beds now they make that can track sleep in different ways. So there's so many different tools, even just on apps on your phone, as far as kind of detecting snoring or other kind of maybe apnea kind of episodes, right? So if you're not getting optimal sleep, even though you're in bed for 7, 8, 9 hours, right, but really not feeling restored, right, there could be certain reasons for that a sleep tracker could help you get to the bottom of as well.
And do you think that's healthy to do that all the time? Or like, I'm thinking about like the sleep trackers or something, sometimes too much information drives me crazy.
Sure.
But you need some information. So would you recommend like doing it for a short term? Like, I mean, studying yourself? And
I definitely think, yes, if you're someone who knows that you might be kind of overly obsessive with that data, that, setting some limits for yourself is a way to find that balance. I think that's a great idea. I think having some data is important, right? Because I sort of mentioned, like, that which gets measured gets managed, right? And so if you kind of never really look at it in sort of a dedicated way, then I kind of feel limited, of how well you can maybe affect that issue, right? So I do think that some sort of assessment's really important in our lives. Even again, if that's sort of a mental check-in, I'm not saying we always have to write things down or get fancy gadgets or whatever. I mean, I'm a big nerd and I like some gadgets and some stuff like that. And, and other things I don't, write down or really keep track of other than in my mind. So it's, personally, it's kind of a mix of different things like that. But, again, just never asking the question even mentally, I think is not going to lead to probably optimal outcomes. I can understand sometimes the temptation to do so, and I certainly would say, yes, know yourself and understand if you have to put boundaries around that, then please do so. And again, I realize this is a lot, like, this is really easy for me to say. Like, obviously, if we could all do these things and no one would, why would we be talking about mental health? Would all be perfectly mentally healthy. But I mean, there's no magic here, right? Either, right? It's just, so I acknowledge that this is sometimes very hard to put into action. But that doesn't mean it's not the right thing to be doing, I guess is what I can say.
I'll
Yeah.
just confirm, I was tracking my sleep and did it, and my sleep started
To go down.
to go to crap. So,
Because you were worried about it.
yeah, backed off. And then there's also a New York Times article this week on so
Yeah.
very timely.
Yeah.
Yeah.
No, I do think, again, overly tracking, right, there is some kind of gimmicky stuff to this, right? It's like it's really trying to, some of these apps are really trying to get you to really use them, and right, it's like, and so they're kind of feeding off a different part of the brain that's, kind of more of this dopamine scarcity cycle kind of thing in the brain, right? And so again, you have to be careful with that, certainly. And I'm certainly not advocating for getting obsessed with, tracking apps and things of that nature. I'm just saying, if you have no idea at all, or you're looking for certain things, like these are at least things that have some evidence, right, to help. Yeah,
Or
this
if you
is
have
kind of what
something
I'm,
going on, then, you do want to.
Right.
Also, data can be a positive thing because, not in your case, because you were sleeping worse with it, but you might see, like, I was sleeping really bad before, but now I've changed some things. And
Sure.
now in the last 2 weeks, I see a
Right.
change.
absolutely,
And that can
right.
be positive.
Yeah. Or just like, yeah, anyway, just I ran this distance in this time, I'm going to do that consistently, right? Can I do it faster, right? Just even simple things like that, right? It's just like, I think any aspect of our health, so in the physical, maybe category, or I walked, whatever, and this and that. So just having an idea, right? So that you can sort of maybe mark some progress, I think is just an important concept in general. So I'm trying to give a little bit of a roadmap maybe to do that in the mental world, where it's a little harder sometimes than like an objective measurement. So there are some, and that's why the only reason I mentioned sort of HRV is because it seems to be tied with sort of that physiologic stress kind of number. It seems to be one of the scientific measures that may be tied to that. And so again, I don't mean to overly say like rely on trackers and stuff. I'm just kind of saying, what is the science showing us might be some clues. So don't want to spend too much time here, but I think, again, I'm talking about mental health. I'm a physician. I just felt kind of like I had to include this slide. Again, if you're watching this, or reasons to sort of seek help, right? If you really feel that discontent, mood, loss of interest, noticing you're very reactive, just unable maybe to get out of just that fear, anger, other kind of cycles, inability to maintain maybe relationships as a result, perhaps, of that, constant worry. Again, this was that sort of constant ruminating, unable to control substance use. Again, I don't believe that, using a substance here and there makes you an addict or has, maybe even any serious health implications. But if then it becomes every day and escalating doses and, this and that, then maybe you really do have an issue that needs some help, right? So that's where I'm talking about inability to control, right? Use is certainly a big red flag. thoughts of self-harm or harming others, right? This is something that's certainly a huge red flag, and certainly has emergency services available to folks for these types of things. Hearing or seeing things that are not there, right? So again, another big reason to really seek professional help, right? So I'm talking about, again, from probably a medical or mental health professional. I think we've hit on a lot of this, but I have several slides on just broken down kind of categories of ways to think about improvement. Again, just giving kind of a framework, right, of thinking about like which of these categories are pertinent to me, which are not, right, which are, can I focus on one month, focus on another month. These are just kind of ways to kind of think about this. So in the self-reflection category, I've mentioned again that therapy, counseling, mentor, guru, teacher, clergy, etc. Right? This all goes into that category of maybe helping with self-reflection. These are things we can help to improve our self-reflection. Journaling, both again, that negative and that gratitude, I think can be important. Sometimes we don't want to necessarily look at the negative things, but again, using that as a tool for, well, okay, this really negative thing happened. What am I going to maybe change about my life as a result? Returning to that again, 30 and 6 months, I think is a really cool idea, and a really, can be a really effective way to sort of at least learn something about yourself, if nothing else. Meditation, right? I've hit on that several times. Again, really a science-based tool to, again, increase the brain's ability to really do some of this stuff, right? It's sort of a workout for certain brain structures to then have the control over those lower brain structures, right? It's almost a workout for the front part of the brain, the prefrontal cortex, quiets down certain ruminative parts of the brain, right? So again, this is an evidence really based practice that shows just, again, how do we increase our ability to maybe have emotional regulation and cognitive flexibility. That's certainly one of the tools. Again, kind of listening to that inner voice, and then the kind of self-talk as well here. So, this is something that, again, just realizing that you have maybe this going on. I think we all have sort of this inner voice and sort of self-talk, self-judgment sometimes, and sometimes we sort of feed that wolf and let them be the boss instead of kind of, again, that prefrontal cortex, the self-talk, maybe more of those reactive emotions from that limbic brain, right? And allowing kind of that more true self to maybe reflect, or to ask maybe that self-talk, like, is that really true? To push back a little bit even, right? So again, just realizing that this is happening, trying to find that inner voice, right? So that this is kind of a similar but different concept, right? Of what are the things that really do bring you that high level of joy and interest, right? And pay attention to that, right? Despite maybe that family of origin or that society or the cultural things, right? If those are things, again, with some bounds, right? If they're not taking away, let's say, from others, kind of basic fundamental human rights, would be at least my bare minimum. But again, what are those things that, again, increase that joy and interest, right? Pay attention to that, and then maybe find a way to, nurture that, in your life. And again, just understanding that emotions are information, that emotions, the happiness is not a feeling, right? That so these are kind of the main concepts I'm trying to get across here. So physical regulation, right? So again, sun, I mentioned that is one of the big influences. The sleep-wake cycle, how much sunlight you're getting. Our brain and eyes have kind of 4 major light detectors of the, again, sunrise, sunset. We have specialized kind of detectors for those wavelengths of light. They really set certain things in our body and brain. And then total amount of lightness, light. So we have a total kind of light calculator, and then we have a total darkness kind of calculator type thing in the brain and, neural circuits. So just keeping in mind, maximizing total light, trying to prioritize sunset, sunrise, and then maximizing total darkness, total amount of darkness, right? And then you don't have to be afraid of, let's say, like switching the bathroom light on or whatever in the middle of the night, your melatonin crashes. Right now, the way it works is actually it's the total amount of darkness you get, especially between, let's say, 10 p.m. and 4 a.m. Right, and so that's what's important is, and again, like moonlight is really really low lux. Like, again, that's not a problem, right? But then we start, the higher and higher we go, candlelight, then our actual electric lights are very much higher, lux. There are these kind of lux meters you can get on the phone if you're curious. You can kind of check some of that out. Movement and exercise.
So sleep, not coffee, or light, not coffee.
Yeah. Well, you can maybe a little bit of both, right? So you can do a little coffee in the morning. So, movement, exercise, right? So any movement, right? This is just standing a little bit more, kind of whatever. There's this concept of exercise snacks, right? Just jumping jacks for 30 seconds in the middle of the workday. Running up and down the stairs, taking the stairs instead of the elevator, all the way up to, yes, I mean, I think for sort of totally optimal, mental health and physical health, you do want to do some form of, cardiovascular exertion where your heart rate's getting up, where you're exerting at least to kind of what's called zone 2 level. And then again, resistance training, meaning that sort of moving, kind of working your muscles against a force, whether that's your own body weight and gravity, working up to maybe, pushing weight or wearing weight and walking, things of that nature, just trying to work on muscular strength. Muscular health seems to be so tied to so many other aspects of brain and body health. So again, just really focusing on that muscular health piece, then you have to include resistance training of some kind. More and more evidence is coming out for maybe some sauna and cold plunging kind of things being an avenue to really boosting kind of both physical and mental health, the release of certain neurotransmitters, the ability to kind of tolerate stress. So this is sort of a physical stress that you're doing on your body within the form of heat or cold, right? It seems to even boost your ability to then tolerate psychological stress is kind of the concept here, and that seems to really be true in some of the studies they're doing on some of these things. So look forward to much more data there, but again, would explore that personally. Seems to be something that does have benefit. Nutrition,
Cold
again.
showers.
Well, so cold showers don't have as much evidence as actually getting in like a cold body of water. Cold water immersion has the best evidence. You have to kind of induce shivering is one of the concepts. So if you're not sort of shivering when you get out, then you may not necessarily confer all of the benefits. So cold showers, I mean, I think, again, usually groundwater isn't like in the 40, 50 degree range either. So so you really have to try to has to kind of lower your core body temperature a little bit to the point of inducing shivering is what a lot of the evidence is pointing at. So yeah, however you can do that, whether that's, again, a bathtub and ice or a cold plunger, there's all sorts. Yeah. So
I'll go for the sauna.
yeah. Sit in a pile of snow. Nutrition, again, kind of the good energy concepts, right? That's one of, kind of a really good book, I think, on the concepts of kind of what is nutrition, how do you kind of fuel your body in the right way. Again, some of the summaries here, this isn't necessarily nutritional talk, but thinking about quote unquote whole foods or like one ingredient foods, right? Foods that a carrot doesn't have other ingredients, an apple doesn't have other ingredients, even a piece of ribeye is just beef, so things of that nature, that are sort of one ingredient foods. Focusing on proteins, omega-3s, focusing on sort of low sugar, high fiber carbohydrates, are kind of key concepts here in nutrition. Addressing those chronic health issues, again, major thing in that physical health category, certainly. So again, controlling blood pressure, controlling blood sugar. That's not to say with medicine again, but making sure that those things are a priority, however you get there. And again, including medicine. I've mentioned this several times, just what are some tools maybe to help with addressing trauma. So EMDR, which is a specific type of, basically therapy, mental health therapy, kind of these eye movement, basically kind of movements have been shown to allow you to kind of maybe detach a little bit more from these highly emotional experiences. And that can be kind of a really meaningful way to explore some of this past trauma and to, develop a new relationship, maybe a more peaceful relationship with that past trauma is really the exercise here. Again, we can't change that, can't make it necessarily not painful or something that, again, it is what it is. That's not what the process is really about. It's about kind of addressing maybe your current relationship with that. And that's what some of these things help you do, is sort of detach emotionally from those experiences and explore them maybe more with that, again, prefrontal cortex kind of more, quote unquote, intellectually, with more curiosity, sort of almost out of your own body, right? Sort of as you can look at that experience as if it happened to someone else, right? Rather than that it happened to you, and sort of find different ways to kind of have a relationship with that past. Things that increase neuroplasticity, can really help here. So, there are certain things here like practices, like I mentioned, meditation, exercise releases BDNF, which increases the brain's ability to grow and build new neural connections. Again, psychedelics is certainly a category here too, but so many other things, so many different practices in our lives really. So the more that we try to learn new tasks, this has been shown to really push neuroplasticity as well. So pushing ourselves to kind of always gain new skills, or to maybe be in sort of slightly uncomfortable spaces, to meet new people, to, increase, to change hobbies and things like that. These are actually other ways to increase neuroplasticity as well, and can be ways to maybe then ultimately increase our mental health. Emotional regulation tools, we talked about the pause and stepping away, breath work. So lots of different techniques here. I only list a couple. Physiologic size, one that does have pretty good evidence. This is the deep inhale, and then a sharp inhale again, followed by a slow exhale. And, if any of you have pets, sometimes you might recognize a breath like that as your dog or something is about to fall asleep. They take kind of this kind of breath, right? And then they sort of relax. And so again, this is something that's sort of built into our brain and body, right? And really has been shown to really relax our kind of, neural, you get into kind of a more parasympathetic nervous system, you're not so kind of in hyper overdrive, and you can maybe have that pause and get back into that, ultimate decision maker part of the brain, and be able to regulate those emotions. So sometimes mantras are helpful here. So what do you do for the 30 seconds? Maybe you find a mantra to repeat, something of that nature, right? Maybe makes you look even more crazy if you say it out loud. But hey, again, the alternative, again, it can be a lot crazier, potentially. So again, this is not about what other people think about you. This is about your mental health and sort of being able to regulate your emotions. So I think the more that we can take some ownership of that and allow other people to think what they might, then, if you're controlling your emotions and not yelling at somebody, then who cares if everyone thinks you're weird? I mean, really, ultimately, it's yeah. So, so that's my personal view.
Point out to you that they think you're weird because you do that, you can say, because I do this, I did not hurt you.
Sure. Or whatever, take this out on someone else later in the day, right? It's not necessarily in that moment, as you were kind of saying, right? If we suppress that emotion, then maybe it's that next person or someone we love, right, who gets the brunt of that anger or something like that. So again, just trying to find ways to accept the way we feel, and then decide what to do with that emotion. So identifying triggers, right? It's a big tool here, right? So don't get in those emotionally heightened states. Maybe, if every time I go to this particular gathering, they always bring up all these topics that really flare me and I lose control and blah, blah, blah. Okay, well, maybe consider stepping away. Why are you always testing yourself when maybe you have this tendency? Stop testing. Why? Is this you don't get a reward protesting yourself, right? You'd be much better off just staying away from the situation, not getting heightened like that. So just identifying what those situations are, understanding that we have a choice to make sometimes. Again, sometimes you don't always have a choice to make here. And so that's a much harder situation to deal with, and would probably take a lot more effort and skill. But and sometimes life requires that of us. But I'm just saying, if it is avoidable, then realize that you can choose to say no and just step away from the situation, or maybe interact with those situations in a different way, in a different format. So however that looks for the particular situation. I think again,
And that also involves like trigger foods.
sure. So yes, again, yeah. People will tell me, well, these whatever client meetings and these things, they always have just donuts or whatever, and I've told people, look, like, tell them that it's metabolic abuse, and that so if you really want to go,
Bagels are
yeah. I don't eat bagels. That's bordering metabolic abuse. So that's yeah, maybe turned some people away from our doors. So so but again, it's just you have to protect, I think, your health in some way, and if you're not doing something for yourself, I just don't know that the world's going to do something for you. I really don't think it is, personally, and so that's what I would promote in everyone. Again, finding a gentle, maybe kind way to relate. As I mean, you have to yell at somebody, but again, protecting your, making those boundaries really essentially is sort of what we're getting at here, right? This is kind of an example of a boundary, right? Is something that doesn't require someone else to do something. I think that's kind of a concept of a boundary, right? You can't say, will you please do this? That's not necessarily a boundary. That's a request, right? So a boundary has to be something that requires really nothing of someone else necessarily. So a boundary might be like, if you do this, I will leave. Okay, so that would be maybe more of a boundary, right? Or, if you do that, like for maybe a child, right? If you jump on the couch, like, I will put you in timeout, not like, please stop jumping on the couch, right? That's not a boundary necessarily. That's a request you've made of your child, right? So in kind of the parenting world, this is kind of an example. And I would say that holds true in adult, kind of interactions as well. Thinking about that, I think, can help you to set healthier boundaries in that way. And then again, just understanding that there's 7 to 8 billion people alive, almost 100 billion Homo sapiens that have perished, in the history of our species. That what you're going through, what you're feeling, probably has been shared by many others over the centuries. That we're not alone. That we're, I think loneliness is a big part of, sometimes not being able to, or we get trapped in these emotions. It's like nobody understands, and this and that. And I think this is kind of the remedy to that. Is that I just don't think that's true. I think statistically, this just can't be true. Again, we're one of 108 billion existences in our kind of, species, right? And to think that, again, especially the feeling, maybe this unique situation, of course, but I think that whatever we're feeling can be shared, with the whole species, and that it will pass, right? That emotions are, again, temporary too, and they're information of some kind. And just acknowledging sort of what this feeling is, I think, is an important part of it. Again, addressing that family and culture, right? That yes, you came from a certain family. They may or may not accept you. You may or may not want to be like them. You may choose a different family, right? Maybe your family of origin is no longer your family, and that's okay. And that's painful, but maybe again that's so amazing that we can maybe do that, or that we have that autonomy. So just kind of thinking about that and understanding that family's ultimately who you decide is family, right, and who you treat as family, and that sometimes is your family of origin, and that's of course very biological and a beautiful thing. But sometimes not all of us always have that, and that then the tribe steps up, and you can still find a tribe, right? And it doesn't always have to be that family of origin. And again, kind of a big thing here, right? In embracing that diversity, right, and allowing each other that space to do that for ourselves. And even if that might not be the path you choose for yourself, but if people are working towards those ultimate goals of, again, kind of increasing enjoyment, satisfaction, meaning in their lives, looking for that kind of purpose, peace, and contentment, delight, right? Then we're all after, I think, the same thing, and just respecting that we can all have our kind of personal journeys, and that, again, culture has a big influence. And that's not to say that, again, that you have to follow your culture, or you have to not follow your culture, but just acknowledging that it certainly has influence. It makes societies kind of the way they are. It heavily influences kind of norms and what people are sort of nudged to do in certain directions. It kind of encourages certain thought patterns of certain types. That's not to say that, again, there are extremes in every direction, in every culture, but it definitely influences who we are and can be an important part of understanding how to become healthier. Spirituality, again, I mentioned that this is a huge part, I think, of the human experience. And here, I think trying to kind of increase the concepts of awe and gratitude are sort of what I get at, is sort of using spirituality to do this, right? So I think those are some of the common things that spirituality really brings humans, right? Is just realizing what a miracle it is that any of us are here, that that there's a plant and so many different kinds of trees and fruits and vegetables and whatever, just if you really think about it, it's like you could just stare at your foot and sort of wonder how amazing this one structure on your body is. So just to have that awe, increase that awe in your life, and gratitude, have that reverence for that again, just how complex and beautiful life is, how much we don't know, how much of life is, if we really get down to the kind of nuts and bolts science, we realize, our senses are so flawed. We really have no concept of what are the kind of fundamental realities of, let's say, especially at the atomic level, of how, particles and matter even works. We're not even really sure. And so, again, just having kind of a reverence for that, we're very limited in what we know. And yet still there's so much kind of beauty in our lives. I think that's really what spirituality kind of allows us. And then connection, right? That we're all kind of connected in some way to each other, and to the world and the planet and the universe, right? And sort of that, again, significance and significance kind of combo, right? That, yes, of course, your experience is very important. It may be the only thing that exists ultimately, right? But it seems that, again, that's one of many other experiences, and sometimes that can at least be sort of a exit to, especially in those painful moments of your experiences, right? Realizing that is shared with with the whole universe, right? And that you're not necessarily alone. And that's where I think insignificance can really play a role in being healthy, and not, sort of this despair of, well, I don't matter, and this, that. That's kind of the maybe negative side of that insignificance. Embracing adversity, right? Just, again, understanding that life is hard, life is suffering, sort of in the Buddhist, term. But again, that, I think all spiritual views really, acknowledge this to some degree, and sort of even require, right, their followers to go through adversity in some sort of way, right? Like things like fasting, or, giving up something of, of the, pleasure, or so many different practices. And, almost every kind of religious view, right, that this is sort of a giving away of wants of some form, or some form of adversity, all the way up to even, self-punishment in certain spiritual practices. So social connection, introvert, extrovert. I just get at, again, we all are connected socially in some way. This is not about you always have to go to every social engagement and be an extrovert, even if that's not what's restorative to you or positive to your mental health. But you have to have some meaningful interactions in your life, I think, to be healthy. And so just understanding what that balance is for you, what's restorative for you, how to use social interactions, at different times in your life to maybe increase your health, when you need them, when you don't. Again, kind of purpose and drive. This is often tied to, meaning, satisfaction. Many of those kind of macronutrients of happiness are tied to other people, right? Enjoyment is sort of even defined by kind of joyful memories with other people. And so again, I do think that this social interaction is a huge, huge part of mental health and ultimately, included in those macronutrients of happiness. And again, just kind of thinking about the health of your relationships. What can you do to improve those relationships? There's things like couples therapy. There's professional help out there too, for certain situations. Even family therapy for let's say parents out there with their children, or even other family members, right? Brothers, sisters, etc. Moms and parents. So adult children, let's say. So again, so many different things that are so important to fix in your life, and it's just never too late, I think is probably my message. So I'll touch on exogenous compounds just a little bit. Again, there are certain things externally that we improve mental health too. I don't necessarily want to focus on this just because this is a little bit more personal between a patient and their doctor, and in a more personal setting sometimes, depending on, again, a lot of other factors here, other health conditions, medications, allergies, etc. But again, there are some supplements that seem to have some evidence to help with certain mental health conditions, increase dopamine, increase certain neurotransmitters, which may lead to kind of better mental health. Here we're talking about L-theanine, magnesium, alpha-GPC, omega-3 fatty acids, EPA in particular. L-tyrosine, L-tryptophan, I believe, also help the formation of dopamine. There are certain, I didn't necessarily put this on here, but probiotic, probably products. We know that the gut bacteria definitely create certain neurotransmitters in our gut, and we don't necessarily know exactly what probiotics might help there, but that's another way that nutrition perhaps helps with mental health, is just, again, the availability of those neurotransmitters. And again, all the way up to kind of prescription drugs, right? There's a whole, multi-million, probably billion-dollar industry around kind of mood, mental health diagnoses. There's several different categories of medications, sort of FDA and off-label, that can be used to increase mental health. And again, I'm not here to say that pharmaceuticals are great, nor am I here to say that pharmaceuticals are useless, right? I think that the way I think about this and the why I put sort of exogenous compounds is that, there's sort of, in a lot of ways, pharmaceuticals can be safer than a lot of supplement, type medications, just because a lot of these things, they're very poorly sourced. They contain all sorts of things you don't know that are in them. And many pharmaceuticals at least have, at least are required to have certain types of, safety certificates and this and that. And again, it's more about what is the biological kind of, reaction, and what's happening in the body. These all have effects in the body, whether it's made in a pharmaceutical kind of way or made from a quote natural plant extract, right? Point is, it's affecting biology in some sort of way. And if that is sort of safe and effective, then let's try that, right? If it's not safe or not effective, then of course that's something that we should try to discover and not try. So that's kind of how I think about these things. And so again, I don't necessarily put a big line between sort of pharmaceuticals versus maybe non-pharmaceutical chemicals. Again, this is not necessarily like exogenous, but there are exogenous ketones, and there is some evidence that again, a ketogenic diet sort of changes neurology and can be maybe a part of mental health in some people, even maybe help manage even perhaps like even schizophrenia, bipolar kind of diagnoses, right? So there's this whole field of metabolic psychiatry that's emerging and looking at things like this. And could, exogenous ketones be used sometimes to maybe boost attention focus? At least I think that's been shown. Again, I touch a little bit on psychedelics here, that there are powerful compounds that can be used to increase neuroplasticity and kind of, especially, it seems like in certain guided fashions, it seems to be highly effective. So I'm not here to kind of promote, again, sort of free, unadulterated use of anything. But I think, again, all of these things in the quote right set and setting, and with, under the kind of right intentions and guides and things of that nature, can be effective tools to really help people address many of the things we talked about here. So some of my resources and some of just other resources for folks, if you're struggling or just curious, whatever the situation may call, some meditation apps here, Headspace, Calm, Waking Up. There's self-hypnosis apps out there, so that if you can't find a therapist that can do hypnosis, you're still interested, you can actually do it on an app. Online counseling. I can't drive, I can't whatever, this, that. I live in a remote part of Colorado, etc. We can do things. If you have the internet, you can try, or even, sometimes these can be over the phone, perhaps. So there are ways to still get something like counseling. There's, again, free kind of information out there that's, even much more detailed than what I've presented here. A lot of my information has come from some of these podcasts and experts. Again, I don't pretend to have discovered it, much of any of this knowledge. I just have, again, reviewed it and trying to relay it to you guys. I certainly have a lot of people to thank for pretty much everything I've said here today. Some of those, again, listed here today. Counselor and reviews, like if you're wondering what does a therapist, what they're good at, what do other people say about them, there's the Psychology Today. Again, it's not comprehensive, but it's one of the more robust lists of psychiatrists by location, to practice type, what they accept as far as payment, et cetera, et cetera. So that's a good resource for people. Of course, if you're suicidal, there are, resources for you kind of in emergency kind of care. There's a suicide hotline of 988. And then, of course, you can just dial 911 or just present to an emergency room. If you already have psychiatric care, often clinics have sort of crisis hotlines and other things of that nature. Again, please ask for help. If that's, you're having thoughts like that, please reach out for help. And again, just for physical health, there's so much now that is free and available to all of us, fitness apps, YouTube, so many different places to kind of find, nutrition advice, all sorts of different things. I try to make some of my favorites available online on my website too, and certainly share those with my patients as, on a case-by-case basis. But so much, out there today that's, again, can really guide you if you haven't done, if you've never meditated before, free meditations, if you've never exercised or, stretched before in a certain way, again, ways to show you how to start that for free rather than having to find an expert. So that's what's nice. That's what I got for today.
Thank you.
Yeah.
That's all.
Yeah, that was it.
Right.
And you record this. So
I do.
we
Yes.
can go back and listen.
Stop the recording now.